Searching for Normal by Dr. Sami Timimi is a provocative and deeply human critique of the modern psychiatric system. From the very first page, Timimi challenges the assumptions that underlie how we define mental illness, drawing readers into a compelling story of how society's hunger for order and explanation has led to an over-reliance on diagnoses that often obscure more than they reveal. The narrative isn't abstract or theoretical, it's grounded in his decades of experience as a child and adolescent psychiatrist working with individuals and families caught in the tension between human suffering and clinical categorization. The book opens with the story of a teenage boy labeled with multiple psychiatric disorders, ADHD, anxiety, oppositional defiant disorder. Through the lens of his complex life, marked by family stress, social alienation, and cultural dislocation, Timimi begins to unravel the damage that can be done when clinicians focus more on fitting patients into diagnostic frameworks than understanding the nuanced realities of their lives. This boy becomes a symbolic starting point for a broader investigation into how psychiatry, despite good intentions, can pathologize natural responses to adverse life circumstances. Timimi doesn't argue that mental distress isn't real, far from it. But he insists that our framework for understanding it is flawed. The central argument of the book is that Western psychiatry, by treating mental suffering as a biological disease, has ignored the social, cultural, relational, and political dimensions of what people go through. In story after story, he shows how children, adults, and families are often handed diagnostic labels and pharmaceutical solutions without the context or support they truly need. The author's tone is passionate yet measured, and his writing is punctuated by patient encounters that both haunt and humanize the book. One such account involves a girl experiencing hallucinations after severe bullying at school. Rather than investigating the emotional trauma at the root of her symptoms, clinicians labeled her with early-onset psychosis and began antipsychotic medication. Timimi's heartbreak is palpable as he reflects on how such responses can strip people of their narratives and, in some cases, worsen their suffering by creating a sense of brokenness that's hard to unlearn. A recurring motif in the book is the concept of normality as a social construct. Timimi argues that what we call normal is often shaped by dominant cultural forces, economic systems, and historical prejudices. He challenges the reader to consider who decides what normal is, and who benefits from those definitions. By tracing the history of psychiatric classifications, from hysteria in women to modern-day ADHD in children, he highlights how diagnosis is never neutral. It's always embedded in power, norms, and expectations. While Timimi is deeply critical of mainstream psychiatry, he is not dismissive of all its tools. Instead, he advocates for what he calls relational practice, a mode of care that centers on empathy, collaboration, and context. He shares the story of a young refugee boy who, rather than being medicated for aggression, was invited into a safe therapeutic space to tell his story. Through consistent, culturally sensitive care, this boy learned to express his pain and reconnect with a sense of identity. This narrative, among others, serves as a model of what psychiatry could look like if it were more flexible and compassionate. The book also explores the damaging impact of psychiatric labels on children and adolescents. Timimi recounts working with a mother who wept with relief when he suggested her son wasn't broken, just deeply overwhelmed. The power of being seen not as a diagnosis but as a full, complex person is a theme he returns to often. He calls for practitioners to shift from "what's wrong with you" to "what happened to you?" A reframing that opens the door to healing rather than stigma. Education systems come under critique as well. Timimi explores how schools have become pipelines into psychiatric care, often flagging children for behavioral issues without considering environmental stressors, learning differences, or trauma. He shares the story of a neurodivergent girl who was labeled disruptive until a teacher took the time to understand her sensory processing needs. That simple act of relational insight changed the trajectory of her mental health, showing how early understanding can prevent long-term damage. Timimi also examines the role of pharmaceutical companies in shaping diagnostic trends. With chilling clarity, he explains how conditions like bipolar disorder and social anxiety have been marketed to the public in ways that inflate prevalence and fuel dependence on medication. He doesn't vilify all medication but critiques its overuse and the profit motives behind its promotion. These chapters are among the most urgent in the book, revealing how economic interests can distort scientific integrity and patient care. Another layer of the narrative involves Timimi's personal reflections, his discomfort working within systems that often contradict his values. He shares moments of professional disillusionment, such as team meetings where young children were reduced to acronyms and dosage schedules. Yet, rather than burning out, he turned these moments into fuel for advocacy and innovation. His honesty about his internal conflicts gives the book emotional weight and makes his perspective all the more credible. In contrast to many clinical texts, Searching for Normal is unafraid to embrace complexity. Timimi doesn't offer quick fixes or universal truths. Instead, he invites readers into the difficult work of listening, questioning, and unlearning. He urges clinicians to resist the urge to categorize and control, and instead to accompany people through their pain with humility and openness. This makes the book not only a critique but a blueprint for a more ethical, human-centered practice. Midway through the book, he shares a powerful story of a family therapy session where multiple generations came together to talk about inherited trauma, identity, and resilience. It's one of the most moving parts of the narrative, illustrating the healing potential of relational dialogue. Rather than being told what was wrong with them, the family was invited to explore what they needed to feel whole. This scene embodies the core ethos of the book, that healing emerges through connection, not correction. The final chapters shift toward broader societal recommendations. Timimi calls for a transformation of mental health services, away from rigid, diagnosis-driven models and toward integrated community care. He highlights examples of successful peer-led programs, school-based mental health initiatives, and trauma-informed practices that prioritize safety, empowerment, and inclusion. These examples are offered not as utopias, but as proof that alternatives already exist. In the conclusion, Timimi returns to the original boy whose story opened the book. Now a young man, he has shed his diagnostic labels and found purpose through mentorship and art. His journey serves as a testament to the book's message: when people are met with understanding rather than pathology, they can transcend even the most difficult beginnings. This story closes the loop, offering readers both closure and hope. Searching for Normal is not a passive read. It challenges its audience. Whether professionals, parents, or people navigating their own mental health, to think differently, feel more deeply, and act more boldly. Through rigorous critique and poignant storytelling, Dr. Sami Timimi dismantles the myth of normal and offers something far more valuable in its place: the possibility of being fully, imperfectly, human.